everybody, I'm Dr. John. COVID-19 has significantly changed the landscape of healthcare and delivery of medicine. In the midst of the pandemic, a lot of doctors' offices and clinics were struggling to find a way to provide healthcare to the patients who really needed it. And telemedicine came to the rescue, and we all thought that that was going to be the future of medicine. So, in today's video, I want to discuss the state of telemedicine in the post-pandemic era in the US. But before we get started, if you want more videos about how technology is pushing forward healthcare, leave a like below. Okay, back to the video. Telemedicine is the act of a healthcare provider, such as a physician or a nurse practitioner or a PA, using telecommunication device to diagnose or treat patients. Telehealth, on the other hand, is more broad term, which is used to describe anything medical or medical educational related that is done over telecommunication device by any medical provider. Telemedicine was first used in hospitals in the late 1950s and early 1960s as a closed-circuit television link to provide psychiatric care for hospitalized patients. From there, it grew to a point before the pandemic where it was a common sight to see telemedicine coverage for psychiatry, neurology, and ICU subspecialties in certain rural hospitals. It was also used by a lot of tech-savvy millennials and busy parents as a way to access healthcare very quickly. Today, due to advancements in technology and legislature, more and more people are using telemedicine. So first, let's talk about what made telemedicine possible. Technology. We are living in the golden era of technology. Majority of the population in the US has a smartphone or another device that they can use to get connected to the internet. And soon, 5G will be available to almost everybody. Companies like Teladoc and Walmart's MeMD and Amazon's Amazon Care and a slew of other companies have popped up offering a variety of services for patients. However, if you use these services, a lot of patients will not be able to find their local physicians on there. So there are a lot of tech companies that provide HIPAA-compliant video chat software to local physicians' offices so that they can provide telemedicine. When these services work, they work really well. But if one tiny little thing goes wrong, the whole experience will be a bad one. The quality of the patient's experience can be limited by poor network connectivity or bad cameras and microphones at either end of the video call. But also, the doctor's job gets harder when the video is blurry and patient is trying to show you a rash and you cannot see anything through the screen. That's where I think 5G and broadband internet are key. Zoom and Google and other tech companies that offer HIPAA-compliant telemedicine products need to continue to improve their products to achieve clarity in video chats. Now, let's talk about physical exam. Since the beginning of medicine, doctors have been trying to find physical findings as markers of certain diseases. And that's how physical exam became part of the doctor's toolkits. Studies have also shown that patients like and appreciate doctors who do physical exam more than those who don't. And yet for some diseases, providers don't really need to do a physical exam to treat the disease. Like, for example, for diagnosing viral upper respiratory illness or for refilling medications for stable depression, you don't really need to do a physical exam. You can diagnose and treat just based on history that the patient provides you. Don't get me wrong, if I've got a patient in front of me in the clinic, I will definitely do a physical exam to confirm my diagnosis. But it can kind of be tricky when I'm seeing patients on telemedicine where I can't really do a physical exam. And so that kind of becomes a judgment call as to how you'd want to treat the patient. Do you want to bring in the patient to do a physical exam, or do you want to just treat the disease anyway? And that's kind of when I use STEP. STEP stands for safety, tolerability, efficacy, and price. Is the treatment safe for the patient? Is the treatment easily tolerated by the patient? Is the treatment efficacious? Is the treatment expensive? Based on this criteria, if the risks of bringing a patient into the clinic outweighs the benefits of doing so, I go ahead and treat the patients. If the benefits of bringing a patient into the clinic outweighs the risks of bringing them into the clinic, then I definitely bring them in for a physical exam. And when I have to do that, I'm seeing the patient twice in the same day, one on telemedicine visit and one in the clinic. And that increases the time that I spend with one patient making one diagnosis. So the possible solution that I'm seeing here is having a nurse triage patients as to who would benefit from telemedicine and who wouldn't. I'm sure if Tim Cook and Jeff Bezos and Sundar Pichai all put their heads together, there will be an AI solution for this. So free idea for any tech companies watching. Make a good AI as to determine who would benefit from telemedicine and who wouldn't benefit from telemedicine. Next, let's talk about training of healthcare providers. After the COVID-19 pandemic, a lot of residency programs have added telemedicine to their curriculum. However, this is not standardized across the board. So your provider's experience with telemedicine will depend on where they went for residency. This needs to change. Right now, in order to graduate from a residency program and to become a board certified physician, you need to physically see a certain number of patients. And that number varies between which kind of specialty you're doing. It would be helpful if all medical boards incorporate some telemedicine numbers into their requirements so that more and more newly graduated physicians have exposure to telemedicine. On a side note, if any healthcare provider is watching and would like to learn how to properly conduct a telemedicine visit, Dr. Dustin Williams from Online Medit has done an awesome series on this. I'll leave a link down below if you are interested in watching. Let's move on to billing and legislature. At the time of making this video in June 2021, in the US, 29 states and Washington, D.C. have now passed parity laws for telemedicine. 8 additional states currently have parity laws in their respective legislative bodies. For those of you who don't know what parity laws are, it has to do with how insurance companies pay doctors for office visits. Parity laws allow for equal pay for telemedicine visits and regular doctor's office visits from insurance companies. If there is no parity law, insurance companies can get away with paying far less for a telemedicine visit compared to a regular doctor's visit. This disincentivizes providers from doing telemedicine. However, due to potential cost savings, a majority of the major commercial insurance companies are paying more and more for telemedicine to incentivize doctors to do it. In addition, laws have not really caught up on what's really possible with technology. For example, if you're building an app that monitors your blood sugars and your vitals, and there's a healthcare provider monitoring these things and kind of making small interventions based on that, these app companies and these healthcare providers don't really have a way to bill the health insurance companies to do these things. The possibilities are endless with technology. But all of these things need to be regulated because it's medicine and it's people's lives that we're talking about. And the last point that I want to make is accessibility. And that is arguably the most important one yet. Healthcare is a social necessity, and it should be easily accessible to everybody who seeks it. People who don't have smartphones or computers have no way to access telemedicine. Homeless population and some elderly folks who may not be tech savvy would be also excluded from accessing medicine this way. This is definitely something to think about when making changes to healthcare. So in 2021, telemedicine is a really good adjunct to delivering medical care. However, there needs to be a lot more improvements before this can be the future of medicine. Thanks so much for watching. If you like this video, share it with your friends. What do you think about telemedicine? Is it the future? Leave your comments down below. See you all in the next video.